Okay, I believe we are now live on YouTube. So welcome everyone to the September 2022 meeting of the Community Services Board. Before we launch into our meeting, excuse me a moment. Okay, sorry, I had an echo going there. Before we launch into the meeting today and introductions, I just did want to, on behalf of the boards and all of our guests here, really, to extend our condolences to Linda and Paul Mashad on the loss of your son, Tyler. Our hearts and thoughts and minds are with you and your family. Also, just a note, another note of sadness. I noticed an obituary in the past couple of days here for Peter Fisher, who was prior member of the Warren County Community Services Board. So I think I'd like to now go ahead and start with some, we'll go ahead and open the meeting, I guess. Holly, do you mind opening the meeting, call to order, and facilitate the introductions?
Sure. Trying to remember how to open a meeting. I just came back to school, so my meeting rules are.
That's all good. You just called it to order. That's fine. We're open.
Okay, we're
open. And do you want me to run through introductions, or do you want to take a handle at that?
I can run through them.
Okay.
Okay. So hi, I'm Holly Arian, part of the Warren County Community Services Board. So I will say your name, and then if you want to unmute and introduce yourself, I'll just go in the order of who I see on my screen. So I have Cindy Wasson first.
Hi, Cindy Wasson, member of the Community Services Board for Warren County.
Thank you. I have Linda next.
I'm Linda Mashad, Washington County.
Okay, I have DLE Page. I can't quite see. There's a glare.
Hi, I'm David LePage, Chief Financial Officer at Behavioral Health Services North.
Okay, welcome. I have Belinda next.
You're on mute.
There. Belinda Bradley, Community Services Board, Warren County.
Julia Beebe is next.
There we go. Sorry about that. Julie Beebe. I'm the Executive Director of Liberty House Foundation.
Welcome. Kathy Wright.
Hi, I'm Kathy Wright. I'm the Director of the HBCI program.
Welcome. I have Amy next.
Amy Seekler, Warren County Probation Supervisor and Board Member, Warren County.
Great. April. Oh, you're muted.
Hi, everyone. April Boucher from CWI, and I also have Steve LaPointe here with me.
Hello.
Hello. I have Heather.
Heather Adams Wendell, Washington County.
Welcome. I have Matt Crave.
Good afternoon, everyone. I'm Matt Crave. I'm the Chief Officer of Crisis Services for Northern Rivers.
Okay, I have Sue Mowry.
Hi, Sue Maury, Washington County Community Services Board.
Jason McLaughlin.
Hello, everybody. Jason McLaughlin, Executive Director at Wade House.
Adrian.
Hi, everyone. Adrian Slico, Director of Crisis Services at Northern Rivers.
I have Linda Wright.
Hi, Linda Wright, Child Support Coordinator for Office of Community Services, Warren, Washington
County. Keith.
Yeah, hi, Keith Stack, the Chief Executive Officer of the Addictions Care Center of Albany.
Great. Jennifer Hill.
Hi, Jennifer Hill, Director of Operations for Behavioral Health Services North.
Amanda.
Good afternoon, Amanda West, Executive Director of the Council for Prevention.
Mary McLaughlin.
Mary McLaughlin, Director of North Country Care Coordination Collaborative at AHI. Good to see you all.
You too. I have Maureen.
Hi, Maureen Mitchell. I'm the Community Outreach Coordinator from OPWDD.
Sue McManus.
Hi, Sue McManus, Warren County Board Member.
Okay. Dylan.
Hey everybody, Dylan Swertner, Case Manager for the Warren County Public Defender's Office.
Thank you. Kristen.
Hi, everybody. Kristen Hardy, Washington County Board Member.
Okay, I think I have everyone except you, Rob. My squares were all moving around during all of that.
Yeah, I know it makes it a little hard to do the introductions. So I'm Rob York. I'm the Director of Community Services for Warren and Washington counties. And we have some folks in the room here. I'll go around.
Adele Pollard, Washington County Board Member. Ariana Murphy, Washington County Rep.
And Carrie Wright was in the room too. She had to step out for a moment, but she's part of it. Will be sitting in on the meeting.
Okay, great. Okay, so the first item is approval of minutes from the July meetings. So for Warren County, is there a motion to approve the minutes? Okay.
Linda, second Cindy.
Second Cindy. Any discussion? Okay, if we're ready to vote, all in favor say aye or signify by raising your hand. Okay, any opposed? Say nay. Any abstentions? No abstentions, motion carries.
And for Washington County, I hope everyone had a chance to review the minutes for July 21st meeting. Is there a motion?
Motion.
Okay, thank you, Linda. Is there a second? Trying to look at all these squares if you're raising your hand. Like,
I'll
Kristen.
second Sue Mori.
Okay, thank you. It's hard flipping back through all these screens here. Any discussion on the minutes from July 21st? No. Are you ready to vote? All in favor, say aye.
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 Anyone opposed? Any abstentions? Motion carried for Washington County.
Okay, for the agency presentations, I think everyone's aware we had our budget review committee from the Community Services Board held several meetings this summer with the agencies and went over their proposed budgets for 2023. I'd like to thank the members that participated with that process and also all the agencies that participated with that process as well. And so what we did is we had some of the agencies come and present at the July meeting and the rest of the agencies presenting today. So just to break it up a little bit, because we had other items on our agendas for these meetings as well. So I appreciate everyone's working along with the process that we have established. So we'll launch right into the presentations then. And I think, Julie, we have you up first.
Okay, Rob, and are we going to be talking about the budget or are we going to be doing program highlights?
It's really just program highlights. If your proposed budget has an impact on services, an anticipated impact on services in 2023, that'd be something to highlight. But we've always done this generally more as a programmatic highlights of any, anticipated changes in the coming year, kind of what the agency's looking at, maybe even any potential issues you're dealing with, struggling with, workforce, things like that.
Yeah. Okay, so just to bring board members up to speed, our request to the county was a 0% increase from the prior year. So we have been able to maintain and not request more money from the county in several years. So we're excited about that we're able to raise revenues in other areas and not have to ask the county or the taxpayers for more money. We do have some program highlights. I'm going to be highlighting 2021. Okay. One of the things that was really important to us was a successful reopening after the mandatory shutdown that we experienced back in August of 2020. So we've been able to successfully reopen. We've been able to remain open. So we're very excited about that. We have not been able to get all of our individuals back to their pre-pandemic schedule, but we're working on it. Some people are just afraid to come in and haven't returned yet. So we're working on that. We're working on that via education and training and boosting and vaccinating. We assisted 100% of our members to be vaccinated. So I believe that that's really the reason we've been able to remain open and we haven't had any kind of outbreak here, is that 100% of the members are vaccinated. And that was no easy feat, because I think if everybody remembers when the vaccinations first came out, you had to register. We were going up to Plattsburgh. We were doing all kinds of things to get people boosted. It has since opened up. Then they had at the mall. It became much easier as the months progressed, but in the very beginning, it was an awful lot of work. So we're proud of that. So 100% of our members are vaccinated and 95% of our staff is vaccinated. We have one individual who's choosing not to be, and that's because they're pregnant. We were successfully able to hook up our electronic health record to HCSNE. And so we're excited about that. So we're able to access HCSNE for all of our members, which really allows us to take a deeper dive into what their needs are. We're able to see a hospitalization. We're able to see a medication change. We're able to really get information that really helps us make good decisions for them here in our program. We also were the recipients of a $26,000 anonymous donation, which is really wonderful. That doesn't happen to us very often. So we were excited about that. And that's been earmarked for a van replacement. We continue to be a provider in the Northwinds IPA as we position ourselves for value-based payment arrangements that are going to be coming soon, I guess. And, we're happy about our participation there. 90% of our members had an annual wellness visit, which included an alcohol screening, a depression screening, and a diabetes screening. So when you think in terms of serving about 100 individuals a year, for 90% of them to be able to have an annual wellness visit and all of those screenings, that's a really positive thing. We were able to develop 5 new employment sites. Again, I think that's probably has a little bit to do with the pandemic, in that people were really hurting for employees. So it kind of gave us an opening that sometimes isn't there for us. But 5 new employment sites is a lot. So we were excited about that. In the past 8 months, 12 individuals new to the program have gone to work and have sustained that employment. Again, that's a big number for us. We created 2 additional volunteer opportunities out in the community at different places. And we use those volunteer opportunities as a way to assess an individual's work readiness, kind of get a sense of what their strengths and weaknesses are, so that when they return to the clubhouse, we have an opportunity to work on those things with them. And very happy to report that we've retained all of our staffing since the pre-pandemic time. So no one is left, which is great. So we've been able to retain everybody. So that's kind of the program highlights for Liberty House.
Okay, any questions for Julie?
Sounds awesome, Julie. Lots of great updates. I wanted to mention too that recently in the Hicksney snapshot, which I'm sure you use, that summary page, there in the top left tile is a flag for high risk and at risk individuals for care management services. So that you might find that helpful, because that would identify someone as having multiple chronic conditions, high hospital utilization, and social determinant of health issues. So I just wanted to mention that.
Thank you.
Okay, well, thank you again, Julie. Thank you for everything you're doing. Thank you and your staff. And great presentation.
Thank you. Take care, everybody.
Take care. Okay, we'll move on to Amanda, council.
Hi, everyone. So program updates, right, Rob?
Sure.
I'm happy to report that we are slowly trying to grow our staff within the budget confines that we have. We, at the moment, are up to 5.25 prevention educators. So I'm very happy to report that our contracts for this upcoming school year being in school districts with evidence-based programs has substantially increased between both Warren and Washington counties. Right now, we are estimated to be in 13 of the 18 school districts. So having that 5th educator will come in very handy. One of our latest things that we will be starting with, I believe, next Tuesday is we have one prevention educator who is actually going to be stationed within one of our local middle schools 1 day a week throughout the school year, doing teen intervene and taking those referrals and walking students through the sessions, and then offering them referral to higher level of care or treatment should that be their case. So we are really excited with this new partnership in one of our larger districts. We only hope that more schools will follow. We also received a grant from the Suicide Prevention Center of New York for the LOSS team, which is really local outreach to suicide loss survivors. So we do have 2 staff who are working on that. As far as our diversion program, we've been doing a lot with it. We actually have someone who just came back from paid family leave, so they are up and running and really providing recovery services and supports, not only to individuals with drug treatment courts, but also starting to run outings out of our recovery center, I should say. With that, we are, as far as our recovery center goes, we're really trying to increase our hours because we know of the need. So starting this month in September, hard to believe it's already here, we are opening up a telehealth timeframe. So really that means anyone can come to the center to access iPads and to be able to get on and access any telehealth services and supports they need. And so we'll have somebody physically at the center being able to help someone, get cued into the iPad, get to whatever groups they need. And we also are starting with open access at the center. And that's really to deliver immediate engagement and assessment and referrals, what have you. So we're really excited because we do know that center participants have been asking for that. We just have not had the staff to fulfill that. Another thing that we're adding, we are doing all of our outings out of the recovery center. We're offering smart recovery, friends and family, community education. So our calendar will start to grow a little more. you know, as we get through the next coming months. So we're really excited. And I think, you know, prior to 2020, we were seeing a lot of individuals. Our recovery center operates on a very small budget. So we, you know, are really trying to stretch what we can to be able to meet the needs of the community. So we are hoping for more funding for our center. Other than that, we have all staff back and we're really excited for the school year. We really are anticipating a substantial increase to our revenue for this upcoming school year. So pretty excited about that.
Great. Thank you for that. Open it up for any questions, comments for Amanda. All right, hearing none. Well, Amanda, it's all good news. Glad to hear those planned expansions and increased revenue. That's good. And we'll have further discussion around the recovery center. See what we can do to try to help with that.
Thank you.
All right, thank
all.
you, your staff, for all your work. Yeah.
Thank you.
Okay, next we have Keith up with the Addictions Care Center of Albany. I know we have some exciting things going on with the with your organization.
Sure. Hi, Rob, and thank you for the opportunity to speak. Yeah, so our two primary program updates relate to our residential programs. Ultimately, both will have budget implications. Last year at 79 Glenwood, which is our women and children's program, we added the third level of residential care to the program. So we added reintegration services at that site. You know, that was pretty simple, straightforward, and it was fine. Oasis has recently created a daily billing rate for reintegration care, and you know, there's not the only real revenue stream for that program is the congregate care rents, and Oasis created a daily billing rate for reintegration services, not the same amount, but similar to the daily rate that we're able to bill for stabilization services and rehabilitation services. So that'll have a genuine and positive financial impact on that particular residential program. It's a new revenue stream for residential service providers. So you know, we're excited about that. We've you know, ideally, you know, we've set aside 4 beds for reintegration services, and it's really for the building. You know, they don't have to go out and get, you know, housing right away. It allows them to stabilize and side of the budget. Won't have any impact on you know, we're not sure how. Yeah, we haven't projected how much revenue we generate, so that's not reflected in is the status of our men's residential program. And you know, we had purchased 68 Quaker Road 2 years ago, started renovation of that building earlier this spring. The renovation is going very, very well, despite, you know, supply chain issues, you know, the ability to hire subcontractors, things like that. The targeted date of substantial completion is still December 14th. And that, is the day when the town of Queensberry building officials can come in and the Oasis facilities officials can come in and, hopefully issue the certificate of occupancy at that time, or if there's any minor work that needs to be done, they'll identify that for us. And then, once we make those changes, we'll receive the CO. So that's going to be a 22-bed men's stabilization, rehabilitation, and reintegration. We'll apply for reintegration services there as well. So we're excited about that. We're, looking to, become operational in January. I have spoken with Deborah Schubeck at Oasis about developing a 2023 budget for that program. And, we'll begin work on that soon, but, that's, there is funding in the, in our contract, the net deficit funding, but we'll have to add the different revenue pieces and other anticipated expenses to flesh out a full budget for that residential facility. The SOAR, the state opioid response funding from the round one has expired. It expired last spring. We have been able to maintain, a good part of our mobile unit services by working closely with the Community Behavioral Health Network and Project Coast, which is they receive state opioid response 2 funding. So we're still up and running and maintaining a mobile presence in Warren and Washington County. Some new services coming through that project should enhance those services, this fall.
Okay. Thank you, Keith. Anyone have any questions, comments for Keith and the Addictions Care Center programs? Okay, not hearing any, Keith. So again, thank you for all your work. I know I'm anxious to see the 68 Quaker come up and online and accepting referrals. So we're getting there.
Getting there, yes.
All right. Well, thank you again. Thank you for the presentation. Thank you for all of your work in the community. All right. I think we're going to move on then to BHSN, and I think we have David with us.
Hi, how are you? Jen Hill is also on the call, and
Jen Hill, thank you.
I may defer to her for some of this, but as you're aware, BHSN came in and started doing mental health and substance abuse clinic services in Warren and Washington County almost 2 years ago. The budget we're presenting for the mental health clinics is a break-even budget for next year. And I think we're presenting a budget with a deficit in substance abuse of about $80,000. I believe the last year that the hospital operated these services, they lost close to $3 million. We've been able to do it mostly through expanding staff. We've purchased a building in Queensberry. We've opened a pharmacy within that building for our clients to access. Our 2022 budget had approximately 30 clinicians between substance abuse and mental health, and we're looking at close to 50 for 2023. And those are just some higher level things we're doing. And Jen, if you have anything to add to what's going on programmatically.
Yep. So really just focusing on developing our services and bringing additional staff on, very much recognizing that we still have a waiting list, growing our school-based clinics as well, knowing that there are a lot of transportation barriers. We actually just launched the start of the school year in all of Saratoga County. And we're hoping to open another school satellite in Washington County pending Office of Mental Health approval. We also are looking at the potential to bring lab draw services within our clinic because we recognize one of the barriers that our clients have frequently is transportation to get to the labs for regular lab testing. So we're hoping to be able to launch that in October or November this year.
Great. Okay, any questions for David or Jennifer? Okay.
Did you say that you had 30 therapists currently and you want to expand to 50? Is that what you said? Are you having a hard time?
No, I said our budget for 2022 was about 30 and our budget for 2023 is 50.
Okay.
Jen can speak more to how many we actually have right now.
Okay, I was going to say, wow.
Yeah.
So we do have, I think, close to 30 clinicians between our school-based program and our Center for Wellbeing. And then I think 4 or 5 staff within our Center for Recovery. We are constantly looking to bring on new staff, and I'm sure
Right.
facing the same staffing crisis that a lot of areas are facing.
Right.
There's not a great pool of candidates right now.
Right.
But we're working heavily with recruiters to do everything that we can to bring more services to the area.
Good luck.
Thank you.
Okay, any other questions, comments? Okay, hearing none. Thank you, David and Jennifer, for your work and everything you're doing in the community. Thank you.
Thank you.
Okay, we'll move on to Parsons Child and Family Center, Northern Rivers. We have several staff with us today from that agency. Matt Crave is with us, Kathy Wright is with us, and we also have Adrian Slako from the mobile crisis team. So not sure who wants to lead off here.
Sure. I was thinking we would take a team approach to have the leaders of each of the programs represented on the call kind of give you an update on what's going on with their programs. And then I would give you a little bit of a broader overview with some of the other changes that are happening. So I guess we could start with Kathy for our HBCI program.
Sounds good. Hello, everybody. So after about 2 years of being down staff, we're finally at full staff. We expect to be at the end of September, and we're really excited about that. We served 85 unique individuals in the past 12 months. Some of those kiddos were served more than once. Some of them were chronic, struggling cases. Even with being down a staff person, we kept our caseload up where we expect it to be, at 12 individuals at any given time, and we averted 90% of hospitalizations. With the sort of straggling effects of COVID, there were really no interruptions to service during that time. We've got some pretty solid COVID protocols in place, including COVID screening calls and masking and social distancing, and families have been great about that, and we've all been healthy, and most of our families have too, which has been great. In the coming year, we're hoping that we can decrease our length of stay a little bit with the implementation of Youth Act, which I know Matt is going to talk a little bit about. So we're hoping that we can serve closer to maybe 100 or 120 unique individuals in the coming year, and maybe a bit higher. Also hoping to streamline our collaborations with ER staff. We're looking to strengthen those relationships a little bit more and increase who we've got coming in to HBCI. And the goal of serving those unique individuals will really be strengthened by if we stay at full staff. So in terms of our hiring and retention efforts, the agency has a sign-on bonus, a relocation assistance. We're always looking at salary and making sure we're competitive. And we're just always evaluating to the like our on-call process and procedure, and making sure we're supporting staff as much as possible, and always keeping a a finger on the pulse of our agency culture and making sure that we're supportive and supportive and collaborative with our teammates. And we've also had the same staff for the last 3 years, I think, too. Some have been here for 6 or 7. So feeling really good about how we've been able to maintain some staff on our team doing really hard work.
Thanks, Kathy. Then we'll transition over to Adrian to give an update on our mobile crisis services.
Hi, everyone. So Mobile Crisis has continued to be very busy. I just did our data from June to June because that's when we pull our data. So in the last year, we increased our call volume by a little over 3,000 calls. So from June 2020 to June 2021, we had 5,110 calls. And then in June 2021 to June 2022, we had 8,201 calls. So we're definitely seeing an increase in the volume there. Our staff, there's ebbs and flows to our staffing. And I'm sure that, we're not unique in that way. Right now in our Schenectady office, we're in pretty good shape. It's actually our office out of Bay Road that we are actively looking to hire individuals. We continue our collaborations with law enforcement and recently have expanded to EMS. Jennifer Eslick, the executive program director, and myself just met with EMS yesterday. So we're continuing to expand our collaboration and partnerships with emergency services.
Thanks, Adrian. Before we continue on for updates on our ACT program, any questions about either HBCI or our mobile crisis services? Okay. So I'll provide an update on our Adult ACT program. We over the past year, we have really remained full in our census. And currently we are working to fill a couple of openings that have recently come about. We have seen quite a bit of transition, particularly from the beginning of this year to about June or so. We saw the transition of our team lead in our ACT program, as well as our nurse, as well as psychiatry. So with all of that transition, we've really worked to kind of bring our team back together, obviously fill those positions, and just strengthen the team and reorient the team to the relationships that we have in the community in order to best serve the community. And in doing that, we were able to recruit a former team member to become the team lead. So he really brought that knowledge of the team with him in kind of reestablishing the team after the leadership change. So that's been a great move for us. So the ACT program continues to work well with its participants. Over the course of the last year, we have served 54 unique individuals. So typically it's a 48-person ACT model. And we typically don't see a tremendous amount of transition with those individuals because they tend to be a little bit more chronic. So over the course of the year, we've seen transition with about 6 or 8 individuals. And then beyond our Adult ACT program, we will be establishing a Youth ACT program in the coming months of this year. We were approved by the Office of Mental Health to establish and begin operating a Youth ACT program in Warren, Washington, and Saratoga counties. And so we've begun the process of recruiting and hiring for the team members for that team, and really are looking forward to putting the team together and establishing the program and working closely with your counties to serve the youth and families in your counties. And as Kathy mentioned, that will kind of expand a little bit the continuum of care that's offered in the community. And I think one of the things that we'll work closely with your counties around is just how that program fits within that continuum of care, and you know, who refers into and out of the program, and how youth and families flow into and out of the program. And since it is a new model statewide, that's kind of an outstanding question statewide. Currently, there are a handful of Youth Act programs operating across the state, but many more are coming online throughout the coming months. And as far as Northern Rivers is concerned, we are about to open up our Albany and Schenectady Youth Act program either the end of this month or the beginning of October. So we'll have a little bit of experience to fall back on in terms of how to sort that out with regard to the continuum of care, but not that much. So it'll be a learning experience that we'll work with everyone around and figure out how to help best serve the families in your community. Any questions about ACT or the Adult or Youth Act programs? Sure, Susan.
I have a question. So that's fantastic news. I've always been a big advocate for ACT, and I think it's wonderful we're getting Youth Act in the counties. I just think that's marvelous. It's okay if you don't have an answer to this, but I'm just wondering philosophically, do you anticipate you will prevent children who are currently being served in the counties from going into RTF placement, for example? Obviously, you'll impact hospitalizations. Or do you anticipate that children who are currently placed in RTFs will come out and drop down to ACT as part of their discharge planning? Or would you anticipate it being an interplay of both? Because I'm just thinking about the impact in the emergency room currently, and children of very, very high acuity that need assistance. Do you see that being a two-way street, or where do you think the initial referrals will be coming from? And congratulations.
Thank you. I think the best answer I can give is yes to all of the questions that you asked. So the real push for the program, and I think why the Office of Mental Health developed it, and the philosophy behind the program, is to keep kids in the community, so prevent RTF placements, prevent hospitalizations, and then to, again, keep them in the community once they've come back from those types of placements. So I think where the rubber meets the road will be how we interface with those other programs. All similar to the Adult Act program, all the referrals will go through the county SPOAs. So it will be a highly coordinated effort, and we'll be closely monitoring the youth and families who are slotted to go into and out of those types of programs, to really get them set up to get the supports of the ACT program, and get that intensive level of care in the community.
Right, any other questions for our Northern Rivers folks? If not, thank you again. Thank you, Matt and Kathy, Adrian. Thank you for all your work, and excited to work together with you in the development of that Youth Act team.
Us as well. Thank you.
Yeah. Take care. Okay, April and Steve, thank you for hanging in. We have you last on our list here, but last but not least.
No problem. Thank you very much, Rob. So like everybody else, we are still digging our way out of the pandemic. We have, fully reopened all of our operating day services programs, community Prevoke, as well as our residences continue to operate 24/7 throughout the pandemic. Unfortunately, we are still seeing an impact on our attendance or census for our certified day programs as a result of some of the COVID protocols that are in place by our oversight agency. Up until about a month to 2 months ago, regardless of vaccination status, if somebody was residing in a congregate care setting, regardless of their vaccination status, if they met the criteria for being an exposure, they still had to quarantine at home and not attend their respective day program. So not only did it have a negative impact on us as an organization, but it certainly had a negative impact on that individual for needing to quarantine, even though they were fully vaccinated and boosted. During the pandemic, we did lose a couple of our employees as a result of the CMS vaccination mandate. So our Article 16 clinic at 37 Everett Avenue, as well as a number of our day habs operate satellite clinics. So in order to be employed at those sites, you had to be fully vaccinated. And we did have a number of employees who were not willing to receive their COVID-19 vaccination. Like many other people in the community, we are continuing to try to keep our heads above water with the staffing crisis that we have going on. We really saw it peak during the pandemic, and it continues we didn't think it could get worse at that point in time, but we continue to see it getting worse, and we're not bringing in the new employees to backfill the ones that have left us to go to other employers who pay more money than what we are able to pay. Our compensation plan is not as competitive as some of the other human service providers in our community. So our focus for 2023 is, looking at, our business models, how we're delivering services, focusing on marketing of the services that we're providing to increase those census across all of those certified day programs in our community Provoke and supported employment, but also to look at how can we not only maintain the staff that we have, but also to bring in new employees. There's lots of other more competitive options out there for them, for the number of responsibilities our employees are required when they're providing care to people with intellectual disabilities. Something that might be new to most of you on the call, we had been without a CFO for a number of years. And then last fall, Mark Donahue, it actually was December, Mark Donahue retired as CEO. As of this past July, we partnered with BHSN in a management service agreement for those two roles. So we've been working very closely with Mark Lukens as well as Dave, who is on the call, and we have some work in front of us, but it's been really invigorating and refreshing at the same time. Does anybody have any questions?
Okay. Not hearing any. Thank you very much, April and Steve. Great presentation. Look forward to working together into 2023.
Thank you.
Yep. Thanks.
All right. So what I'm going to do is try to move on the agenda a little bit here. Holly, I know you mentioned you have to step off. If you have to step off the call before we get to the votes, you're familiar with the plan that I'm going to be discussing because you're on the ad hoc committee. Would you be willing to leave a proxy vote of approval on these items that you see? We have the 3 business items that we'll be voting on. So
yes, absolutely. Is that a verbal proxy or?
we may want to follow up and get it in writing, yes.
Sure.
But just wanted to alert you to that before we get into it here. Okay, what I'm going to try to do then is present, I guess the first thing we would want to do is go ahead and conduct the vote for the contract agency budgets. So this is the recommendation that came out of the Budget Review Committee this summer to recommend the agency budgets as presented. We sent out a table as part of a packet this afternoon to the board members. So you should have a table in your email. But the totals for Warren County, total of $4,925,796. And in Washington County, it's $2,867,613. Those are the agency budgets as well as the Office of Community Services. So we request the approval of those amounts for budgets and contracts for the counties.
Okay, we can start with Warren County. That's all right. So is there a motion to approve the 2023 contract agency budgets for Warren County?
Cindy, second Belinda.
The second Belinda. Is there any discussion? Okay, if we're ready to vote, then all in favor, please signify by saying aye or raising your hand. Okay, all opposed, say no, or raise your hand. Any abstentions? Okay, motion carries.
And for Washington County, can I have a motion for the approval of the 2023 contract budget for Washington County? Can I have a motion for approval?
Linda.
Okay, so Linda. Can I have a second?
I'll second.
Okay, Sue. Thank you. Any discussion? Does anyone have any discussion after looking over it? All in favor, say aye.
Aye.
All opposed, say no. Any abstentions? Motion carried for Washington County.
You could abstain.
What was that, Rob?
There's an abstention.
Okay.
Adele Potter on the CWI vote.
All right, thank you, Adele. Okay, motion carried for Washington County.
Okay,
Thank you.
thank you. Okay, I'm going to try sharing my screen here. I can get back to it. Right here, yeah. Okay, our board members seeing an Excel spreadsheet.
Yeah, yes,
Yeah.
Rob.
All right, so this is just a list of our ad hoc committee members, Belinda, Holly, and Cindy. Been meeting with them, facilitating the meetings, but this is the ad hoc committee. As you know, Warren County set aside $1 million of their ARPA funding, American Rescue Plan Act funding, designated specifically for behavioral health services. So we utilized the same application process as the county did. Agencies and entities were encouraged to apply through the portal on the Warren County website. We ended up receiving a number of applications here, actually totaling up to 4 million. So we have some difficult work here to do as an ad hoc committee and as a board, and some decisions to make. The ad hoc committee pulled together, has met 3 times, and we went through all the proposals. There's a scoring sheet, which I'll also see if I can bring that up here. Are you seeing an evaluation form?
No.
No. Yeah, I always have trouble with this. Well, anyway, we use the same evaluation form as the county, various criteria for scoring. And of course, various factors were also taken into account in terms of, like, you know, what was the reach that the proposed project would have across the community? Do they contained in sustainability plan, the clarity of the proposals and the budget, and the strength of startup funding requests. So what we're doing as the ad hoc committee, we're proposing to bring before the board is we've separated some things out. We took the proposals and we determined that actually 3 of the proposals, one from 820 River Street, the Council for Prevention, and ACCA, could actually fit under the same criteria for the opioid settlement funds. So we thought, well, let's think about pulling them out and proposing to fund those through opioid settlement funds. So those are the ones you see highlighted in blue. I'm hoping you're seeing that on your screen. So I'll talk more about opioid settlement in a few minutes, but that's why those are out. The first round that we wanted to propose for funding includes the White House proposal for $88,517, Look Media proposal for $25,000, the Adirondack EAP proposal for $26,367, and Brayton Psychological Services project proposal for $3,000, totaling $142,884. That leaves us still with a balance you see over here of 850 some thousand. The reason that these proposals made the first cut was because some proposals include multi-year request. Some proposals included proposing multiple staff. And we wanted to go back to some of these agencies and proposals to work with them to see if there's something maybe we could do a little bit less. We might want to trim some with them. We might want to even some of them just were requests for additional information and clarity. But rather than holding up things, we felt that this first group of 4, these were clear one-time requests. There was a clear sustainability plan for the White House proposal. The others are really kind of a one and done type of request, and they don't fund any personnel, beyond the one-time request. So we wanted to propose to go ahead and advance these for funding with ARPA funds. So I would request a vote of approval for that today. And then we'll be continuing to meet and engaging in some dialogue with these agencies around their proposals, and then bringing back additional requests at future meetings. So the item up for request for approval then is for approval of the ARPA contracts and budgets with the agencies entities highlighted there in green. Any questions, discussion on this? Are we may have lost Holly. So I would need a Warren County board member to entertain a motion.
I'll make a motion. Cindy.
I'll second.
Cindy, do you want to go ahead and conduct a vote? Just ask for yays and nays.
Can I get, I can't see anybody, so can I get all the yays for the motion?
Belinda, yay.
Holly did type a yes into the chat.
That's right. And I'm a yay.
I'm a yay. Are there any abstentions? Is that?
Yeah, this is Sue. I have to abstain because the AP are included in
right.
it. Mhm.
Were there any opposed?
And it's carried.
It's carried for Warren County. Thank you. And as you know, this is a Warren County only vote. Now, what I would also like to request is really the second part of this then is to move down to opioid settlement funds. Again, I'm a little challenged here, but I'm going to try to do this. I did put together a spreadsheet regarding the opioid settlement funds, and I don't know if that's showing on your screen at the moment.
It is, Rob.
You see where it says Amerisource Bergen Corporation?
Oh.
No. I don't know why I have trouble doing this. I'm going to try this again.
Yes, now we see it.
Okay, good. So what I did is I put together a spreadsheet. It's a projection estimate of the opioid settlement funds for Warren County. These are the various settlements. There's several different settlements that are involved in this. And these are the projected funds by year. And there's also two buckets for each year. There's restricted and unrestricted funds. So in terms of the restricted funds, those have to be used to address the opioid crisis, have to be used to expand addiction and opioid services, to support those services, expand those services, et cetera. Unrestricted funds, the county could determine to use those funds for other purposes. However, it appears that the county has the will and interest in using these funds to address the opioid crisis. So the proposal here is to take those applications, and I included the amounts here again that you can see here toward the bottom in the middle. That's the amount that we'd be looking to try to fund. It's $383,096. Now, again, keep in mind, some of these are multi-year proposals. So we could break out that number and have that number reduced somewhat in working with the agencies to fund some this year and then some next year. But looking at this, this is our total for 2022 is $365,142. That's what's anticipated. If you look and we go across the spreadsheet here a little bit, I'm just going to show you how the out years start to look. And that bottom line would be our total per year from the various settlements. You see some settlements were one-time funding. That's why the 2022 is such a large number. And then in future years, some settlements have a break and then they pick up again for X number of years, and then some continue steadily for several years. So you can see this goes through 2023, 24, 25. We jump up again because of that. There was a skip there for one of the settlements. So it'll be up around 95,000 for 6 years there. And then it jumps back down to 57.9 seems to be kind of like the steady number through the balance of the years. And this goes out, as you can see, 17 years for a total of 1.8 million. Now I think that if we could agree that we want to try to fund these proposals, that it would fit within the uses of the opioid settlement funds.
Mm-hmm.
So the proposal, I guess, to the board is to advance these and request to the county to develop contracts and make budget amendments from the opioid settlement funds in the amounts that are shown. And again, when I say that, the total for the applications, because it's more, it's 383 and not 365, we would be working with the agencies in the county to stage that, and so that some of it is funded this year and some could be funded next year or in future years.
Do you want me to make a motion?
Yeah, why don't you make the motion and then just conduct the vote.
Okay. Can I get a motion to approve the one-time payments for the opioids?
I'll make the motion.
I'll second it.
Okay, and are there any questions on it? All in favor?
Aye.
Aye.
Two. We already have Holly, so me, and then Amy, so that's 5. Are there any abstentions? No. Okay, it's carried.
Okay, so process-wise, the ARPA requests will now be carried forward back to the Warren County ARPA Committee. And then upon their approval, really, they just wanted to eyeball them and make sure they were in line with the opioid or with the ARPA guidelines. And then their plan is to forward these on to the Finance Committee at the county and for final approval. And then for the opioid settlement funds, I'll be advancing that request through my regular health services committee at the county, and that will then go before the full board of supervisors. Okay, thank you everyone for bearing with me there on trying to do the screen share and everything. Any other questions, comments on this portion of the meeting? Okay, for our board members, we also sent out a brief summary of the projects in your meeting packet. So if you didn't get a chance to see those, they are in your email, and those were taken right from the applications, the project summary for each of the 4 that we approved today. Okay, our last real item that we have on the agenda is the 2023 local services plan update. And Carrie Wright is going to provide that for us. And Carrie, maybe easy if I step away here and you just come over and everyone can see and hear.
All right, so we won't take a whole lot of your time, but they did change the county planning system in which we usually do the local services plan has now changed. The timeline has been completely revamped. So this year, let's see, I have dates in front of me. The new forms are going to be due October 31st. And they are a little shorter, less convoluted, so that is a positive thing. And then following that, there's going to be 3-year plans. So from 2024 to 2027 will be one full plan. And then I think every 2 years we will update it. So the whole process is changing instead of yearly. But we're still working with last year's plan. I'll still have a PowerPoint to go over some of the main focus areas. One of the differences this year is that I've always worked with public health in Warren County on their CHIP-CHA assessment. Much of the prevention goals for Department of Health are very similar and are around mental health and substance use. So it only made sense to kind of piggyback on what they're doing and integrate that into our plan. We've all heard about social determinants of health for years. We've had the pandemic and seen how, you know, all of these things are interrelated. So having two separate plans for public health and community services didn't make a lot of sense. It's not exactly the same, but it's a lot of the same data. And I just thought it would, you know, make sense to reflect all of that. So I did also send out a survey. So for those of you that participated in that, we appreciate it. And just for your knowledge, they did last year when we did some of the surveys through our conference for the local services plan. The 4 top areas, which will be of no surprise, are workforce, number 1, recruitment, retention across all 3 disability areas. Second is housing. The third was crisis services, and the 4th is transportation. Those are really always kind of the 4 big areas, but they were really highlighted. Obviously, workforce, as you just heard every agency speak to, seems to be the biggest challenge right now. So thank you for your feedback. If you participated in that survey, really appreciate it. It sort of gave voice to what we already knew or thought, but it was good to get that as well. So that's all I have. Any questions on that process? All right, thank you guys.
All right, thank you, Carrie. You know, it's been a different process this year, so Carrie's really followed right along with all the state updates. She's been working closely with our public health and looking at some of the other community assessments and community planning that's done in other systems and other departments, and trying to pull that all together. So thank you for your work. At some point later this fall, October, November meeting, will bring the plan.
Yes, due on the 31st of October. So the following week, Wednesday in
November. Yep. So we'll probably have a brief presentation in November on the contents of the plan. All right. Well, I thank everyone for your participation today. Does anyone have anything else? I think we've reached the end of our planned agenda here. Sue, I see your hand raised.
Yep, I just want to remind everyone, tomorrow is the first annual brainstorm event at Crandall Park, 10 until 2. We've got approximately 40 vendors coming. Response to this event has been phenomenal. We have great speakers, brain gut connection, science of addiction and recovery. We have Tai Chi. We have trauma-informed yoga. This is a collaborative of all of the agencies in the area brought by Access and the subcommittee treatment team. I really want to give a shout out to Amy Secor, who really came in strong for us in the past couple of weeks, getting us some great publicity through Don Lehman. And wow, the outpouring has been amazing. So come with a stick of chalk tomorrow, right on the sidewalks. We want to see positive affirmation about hope and recovery and wellness in our community. It should be a beautiful day, the place to be. You can go to the car show later. My husband will be at the car show if you want to see him up there, but come and do 10 to 2 with us at Crandall Park tomorrow.
Very good. Yes, thank you for bringing that forward, Sue. If anyone needs additional information about that event, or you've not lost track of any, emails or any notifications you've received, just let us know. We can re-forward flyer information about that.
I just want to say that we did the chalk outside in front of the municipal center, and we had people join us while we were out there, so it's contagious in a good way.
Those you chalkings was super cool, Amy. And then we were at Crandall Library last Friday, and yeah, the general public just joined in and did some really cool artwork. It's really nice. It's really lovely to just spread hopeful messages and instead of worrying about what we don't have. Look at what we do have in our community. It's amazing. We are amazing when we're together and collaborative.
Yes, absolutely. Okay. Heather, hearing nothing else, do you want to close us out maybe?
Sure. Just a reminder that we have our meeting coming up October, is it 13th?
Yes.
Am I correct? October 13th is our next meeting. And if nobody has any further discussion, motion to adjourn the meeting, the September meeting. So.
Motion to adjourn.
Okay. Hope everybody has a wonderful day.
Yep. Thank you, everyone.
Thank you. Bye.
See everybody soon.
Yeah.